We welcome all to this session. Today, our guest is Dr. BIBHU Prasad Panda. Let us begin the session with 1 minute silent prayer. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, doctors, and students. Today, our guest is Professor Dr. BIBHU Prasad Panda, MD, Homeopathy. So the principal and homeopathic superintendent, Hall Institute of Homeopathy and Research Hospital, Vadodara, Gujarat. Sir has an experience of 31 years in profession and has a teaching experience of 28 years. As an academician, was worked as a lecturer to professor in an HOD organ of medicine and homeopathy philosophy at Raipur Homeopathic Medical College, Raipur. Then 2000 to 2002, professor HOD organ of medicine, academic in charge, Taukasi Homeopathic Medical College, Bilaspur. And from 2002 to 2004, professor and organ of medicine, Narayan Sri Homeopathic Medical College, Bhopal. And 2004 to 2017, professor, organon of medicine, RHMC, Rajkot, Gujarat. And 2017, professor, organon of medicine, RHMC, Rajkot. And 2017 to 10, April 8th to December, professor in FSH at JBWU, and 2018 to 25th January till date, professor in organon of medicine, PIHR, Vadodara. As an administrator, Sir has worked as the principal, Raipur Homeopathic Medical College, academician in charge, principal, hospital superintendent, Narayana Sri Homeopathic Medical College, and so many fields Sir has worked. And as you all know, there are a lot of articles published on immunology and homeopathy, Homeo Times, constitutional prescribing, Lexia, homeopathy fails not, homeopathy, prana, computer vision syndrome, triology of homeopathy, holistic health and illusion, prana, paper presentation on uniqueness of homeopathy at National Seminar, Udaipur, Rajasthan, dynamics of student-teacher relationship, National Seminar, SMCOM, Anand. He has a lot of training experience in different part of the India and different sections of the society. And today, as I will be discussing about application of organon of medicine in daily practice to treat and our preparedness to deal with it. This is a very, very important subject as far as our philosophy is concerned, and practice is also concerned. So let us proudly welcome the guest of the day, Dr. BIBHU Prasad Panda. Welcome, sir.
Good evening, sir. I am audible, sir?
Yes, sir. Yes, sir.
You have to make him the host.
Yes, sir. Yes, sir.
You are not making the host.
Yes, sir. I shall make it. So.
You have to make him the host now.
Yes, sir. Yes, yes. I am making, sir. Please wait. Okay. Okay. Done, sir.
Let me continue, sir.
Yes, yes.
So thank you very much, sir, for your nice introduction. Actually, you are all seniors. So first of all, I congratulate all of you that you have completed 1 year continuous delivering this type of lecture for the our fraternity. So let me share my screen by which I can continue synchronously. One minute, sir.
Right.
Is it visible, sir?
And no, not a share, sir. Please. Yes, it is coming. It is coming.
Now, is it visible?
Yes, yes, yes.
So let me continue, sir.
Yes, the first page is already there in the screen. So you can go put it in a slideshow and then go ahead with the session, sir.
Sir, so the topic, that is application of organon of medicine in daily practice to treat and our preparedness to deal with it. All of you know that there are three subjects which are called the pillars of homeopathy, that is mathematica, organon,
और वापस एक पहाड़ी पे
and
गाड़ी बनवाती
so there is some sound which is disturbing.
के पास जहाँ शहर का मशहूर सुसाइड पॉइंट था
Please, sir, I shall please one
So I
minute.
would like to request someone is
Sir, please wait. I am going to mute all. Then then uh, then, then
उसके कानों में फिर से वही आवाज आई मैंने बोला
yes, sir. Yes, sir. Now you can start presentation, sir. Please unmute, sir.
now I am audible, sir.
Yes, yes, everything fine. I have muted everyone, so you can.
Let me, actually my screen is not moving. Yes. So today we'll discuss the following title and following subjects like applied organon medicine and treatment of acute diseases. Acute disease, again, as we have studied, divided by individual, sporadic, epidemic, and pandemic. Then acute exacerbation of chronic disease. Acute diseases appear during treatment of chronic disease. And fourth one, that is acute episodic attack of chronic disease. So in each and every cases, with example, I want to share that how the knowledge of organon is inevitable to get a good result. Second, applied organon medicine treatment of chronic disease. So chronic disease as classified in, by Hahnemann, non-miasmatic chronic diseases, artificial chronic diseases, pseudo-chronic diseases, then under miasmatic chronic disease, single and complex. And lastly, we'll conclude and we'll discuss the topic or interact with our all learned persons. So as I have already told, we have three pillars in homeopathy: mathematica, organon, and reporting. Without these three pillars, the homeopathy cannot establish. So each one is dependable on another. So what mathematica, which type of role mathematica plays, and which type of role organon plays, and which type of role reporting plays, in the next picture we can see. So I have present a bar. So the trunk of the bar is mathematica. Without trunk, it is not possible to live by the bar. So it is the storehouse. So our storehouse is mathematica. So if someone wants to travel from Baroda to Bombay, then he needs money. First, the money is needed by which he can able to get different way to travel from this place and reach at Bombay. So mathematica is highly essential. Even we have already seen some quacks and some doctors, they are practicing homeopathy in village area only by following the mathematica. I have seen even in my village only seeing the Boric mathematica as well as NM Chaudhary mathematica. Some school teacher they are practicing. So mathematica is highly essential, and the knowledge of mathematica is needed to practice homeopathy. Second thing, the wings can be compared with organon, because to go ahead, we have to fulfill the principle, and if we not fulfill the principle, we may do practice, but we can't success. For example, Hahnemann has written in 275 aphorisms that medicine should not be administered in liquid form. Nowadays, what the newcomers they are doing, they are purchasing the liquid form 30 potency, 200 potency, and they are advising the patient you take drop dosage. That is completely wrong. Hahnemann has already written that 1 drop of medicine can medicated 300 poppy-sized globules. So if you prescribe in drop doses, then you may face unwanted aggravation. That's why poppy-sized globules must be prescribed, and that poppy-sized globules to be put in sugar milk. Again, that dose will have to put in liquid in water, and that water will be given to the patient to take. So that is the right way of administration of medicine. That knowledge we are getting from organon. If our dose will be not proper, then unwanted aggravation will face. As written by Hahnemann in 246 aphorisms, we have to fulfill the knowledge. We have to fulfill 3 conditions. So every physician must have thorough knowledge about the disease, about the medicine, about the application of drug knowledge into disease knowledge. So the knowledge of disease is acquired by means of case taking. The knowledge of medicine is acquired by drug proving, and by comparative study of different system, we can able to know that which system is good and which system should be applied to get a good result. So this knowledge is essential. So organon is the pillar which helps us to go ahead. Organon is the pillar which helps us to show that how many ways to achieve the target. So there are so many mode of transportation to go to Bombay from Baroda. For example, by train, by plane, by car, like this. So organon, these are the different way that knowledge you can get from organon of medicine. Then repertory is the third pillar that act as a compass. As you know, the sheep goes ahead in the right direction to reach in the right place in proper time within a short time. That compass helps us to the sailor to how to arrive in the target. So repertory knowledge helps us that out of these 3 or 4 ways, which way is shortest, and how can you reach the place within a shortest time and perfectly. That knowledge you can get from repertory. So these things here I have written, I have quoted. The homeopathy is compared with a bird with its body represented by mathematica, wings by organon, which is correct direction, and by the correct direction is given, the knowledge is acquired by means of repertory. So all the knowledge is essential to achieve a radical cure. Suppose we select the good medicine, and if that good medicine will be not administered in proper dose and proper potency, then it will be useless. For example, in Boric Mathematica, it has been written that bacteria act in better manner in case of typhoid fever if it will be prescribed in mother tincture form. So if the selection of medicine is correct, that is bacteria, and if it will be not prescribed in mother tincture form in typhoid fever, then we may not succeed in that case. The third condition, that is repetition. We need the simillimum. So simillimum must be selected from out of all similars. For example, a person is coming having fear of death. So if the person is having fear of death, so we may get so many medicine like arsenic, like aconite. And if the person is predict the date and time, then we have to prescribe aconite. So this knowledge we will get from organon of medicine. In 153 aphorism, Dr. Hahnemann has written that we have to collect the characteristic symptoms, uncommon, peculiar strength symptoms to select the medicine to form the qualitative totality. So we don't need quantitative totality. During case taking, we collect so many symptoms expressed by the patient, but out of those totality, we need the qualitative. So Keynes had written that we may collect thousands of symptoms, but if those symptoms, it will not help us to find out the perfect remedy, then that cannot be called the totality of symptoms. Only one symptom if it helps us to find out the correct remedy, that can be considered as totality of symptom. So for homeopathy, we need the qualitative totality. We don't need the quantitative totality. So we have to collect the characteristic symptom, and that knowledge is will get from organon of medicine. So out of all symptoms which are expressed by the patient, which are collected by the physician as objective symptoms, which are collected from the attendance unrelated as objective symptom, even the investigation, out of those symptoms, we have to take the qualitative symptoms, and that qualitative symptom helps us to find out the remedy. We don't need the knowledge of nosological diagnosis for selection of homeopathic medicine. I am giving an example that a patient who is coming from polyuria, polydipsia, and polyphagia, so we will diagnose the disease that is diabetes, but we cannot select homeopathic medicine. But if the patient will come having thoughtlessness, if fear of opposite sex, changeable mood, and then shifting nature of pain, then you can select pulsatilla. So these types of symptoms are not needed for nosological diagnosis. So we differ from that for our individualization, because homeopathy is based on individualization, dynamic concept, and that dynamic concept, that individualization concept, the knowledge you are getting from organon. So if that knowledge will applied when we are practicing, then we can able to get our target and we can cure the case. So without this knowledge, you may select medicine, you can't select proper dose. We need minimum dose. What is minimum dose? Everybody should know. So minimum quantity of medicine which can produce a least possible excitation in the vital force and able to remove the disease force. So there is no quantity here. So that the quantity that must excite the vital force, by which the vital force will be able to remove the disease force in secondary curative action. So this knowledge we should have. What we are doing, we are giving 2 to 3 medicines at a time. We are not considering the dose. We are not considering the potency. So if we have no knowledge about susceptibility, we are not able to judge the reaction power of the patient, then we can't able to judge select the potency, because it is abstract thing. It is a qualitative existence. We can't measure it by any type of weight or any type of measuring tape. So that is gained by, that knowledge is gained by organon of medicine, and that should be applied whenever we are select the potency. And if we'll discuss what is the definition, so applied means put into practice. So the knowledge of organon which you are gaining during a study, that should be applied when you are practicing, and if that will be applied, then we will achieve our target. Otherwise, we may select a medicine, we may prescribe a medicine, we will fail to cure, even we fail to select, fail to manage the patient. If the patient is not in our jurisdiction, we have having certain jurisdiction, we have having scope where the diseases are arise from nature. So we have a limitation where the diseases are not arise from nature. So we should know about our limitation, and we should know where our limitation is ended, and accordingly we have to select the case. That is also more important. So application of the principle and logic mentioned in organon for restoration of sick to health and preservation of health, that is the applied organon. For applied organon, I can correlate it with the other subject. For example, applied anatomy. Applied anatomy, the knowledge of anatomy helps us to know about the different structure of our body. And applied anatomy helps us to apply that knowledge of structure in day-to-day practice. I am giving an example. In our Mathematica, in Belladonna, it has been written that is pain in right ileocecal region. So pain in right ileocecal region, Belladonna the medicine where the pain comes suddenly, goes suddenly. If the person has no knowledge about anatomy, then in that position, the appendix is present, ileum or cecum in the joint, the the appendix present. So that is the appendix pain, acute appendicitis. So this knowledge we get from anatomy. That is applied anatomy. Same thing again. From applied anatomy. So there is, if there will be any block, if there will be any type of problem or stricture in the artery, that is retinal artery, the person becomes blind because there is no anastomosis. So this knowledge helps us to consider that if there will be any type of obstruction, either due to a embolus or due to thrombus in retinal artery, the person becomes blind. So this applied knowledge we should have. Likewise, you may know so many medicines from Mathematica, but if you don't know how to select the simillimum out of similars, if you don't know how to find out the minimum dose, what is the potency of that particular person, then how we can repeat it, in which what should be the duration of repetition, then we'll fail to cure radically and judicially. So as I have discussed that we need knowledge, that is 3 points of cure described by Hahnemann in 71. The investigation of the disease, that is case taking 83 to 104. Then investigation of the medicine, that is drug proving 105 to 145, and judicious employment of medicine 146 to 291. So this knowledge we should have, and not acquiring this knowledge, you have to implement this knowledge when we are going to cure. So again, from organon you can able to know that which case we have to handle and how we have to handle. Case selection is most important. Yes, Hahnemann has written that those cases which are not natural, like poisoning, like drowning, so those cases we should not deal. We have to manage and we have to report the case. After the vital force becomes strong, then you can administer a medicine for convalescence period, because they are not natural. That occurs in healthy state because of accident. So those who are not natural, we should not take into our custody. We have to refer those cases. This knowledge we get from organon of medicine and should be applied. Another example, Hahnemann has clear-cut mentioned the indisposition. Indisposition means those who are not real diseases. That can be corrected by managing the diet and regimen. They are appeared in form of trivial elements short time previously. So if a person is suffering from vertigo early in the morning because of night watching and came to the clinic at 10 a.m. and we considered it as a disease, it is our mistake. So this is not disease. This is indisposition. This is what mimicking sickness, and that should be only corrected by regulation in diet and regimen. You advise the patient to first sleep. There is no need to prescribe any medicine. That knowledge we are getting from organon of medicine, that should be applied. Here, to please the patient, we have to give placebo, and we advise only, we have to change the regulation of diet and regimen by which the patient can be cured. Then during case receiving, during case taking, Hahnemann has already advised that what are the general direction we have to follow, what are the special direction you have to follow, what you need to follow when you are collecting a case where the cause is obvious. But one example I am giving, if the cause is obvious, the patient does not want to confess it in front of you, then what you need to do? You have to ask question tactfully. You have to create the confidence in the mind of the patient by which the patient will explain you sincerely and privately. So obvious cause means where the cause is drowning, suicide, where the cause is related to sexual problems. See, in those cases, what you need to do, you have to ask the patient privately. You have to create confidence in the mind of the patient by which the patient can explain correctly and the real cause. And for example, a patient is suffering from sleeplessness, insomnia because of bad effect of love, because of grief. Then if it is acute, then you have to follow the second type of mental disease. You have to select a medicine, that is ignatia. So here there is no need to prescribe any type of sedative, even homeopathic sedative like passiflora. So passiflora will not work because the cause is something different. As you know, in homeopathy, we have to remove the cause. We don't want to remove the effect. If the cause will be removed, automatically the effect will be removed. Here the cause is grief. So we have to consider the medicine according to grief. In homeopathy, we need to remove the process, not the product. In homeopathy, we consider the beginning, not the end. In homeopathy, we have to consider the world of thought, not the world of matter. So these things if we consider and we treat accordingly, then the effect, the product, the end, the world of matter, which is the condensed form of world of thought, that will be managed and that will be cured automatically. And again, case recording must be done for further prescription for second prescription. If the case recording is not perfect, then to prescribe second time it is very difficult. So case recording must be correct. That knowledge is gained from organon of medicine. So what symptoms we need to record, what symptom is not necessary, which are the symptoms which appear and which symptom are removed. So case recording performer helps us to find out, and accordingly we have to go ahead for second prescription. So okay, as I have already told that certain cases does not come under our jurisdiction. We should not handle those cases. Real surgical diseases, true surgical diseases, anyone has mentioned, true surgical diseases where we have to take the help of mechanical aid. For example, a person is suffering from fracture. So in fracture or dislocation, what we need? We have to take the mechanical aid. We have to refer the case to orthopedics. After plastering, we can give our medicine like calcirephos, like symphytum for speedy recovery. But our symphytum are calcirephos, they cannot reunite the bones if there will be no, you will not take the help of mechanical aid. So this knowledge we are getting from organon medicine. Again, certain diseases, certain surgical diseases which are not true surgical diseases, like what? Like calocities, like keloids. So these are the diseases which are not true surgical diseases. In those diseases, we have to see, because they come outside because of the internal cause. So we have to give internal medicine. We should not apply any type of external applications. Then only it will be cured. Of course, in certain cases, Hahnemann has written in 282 footnote. Hahnemann has written that in old cases of what you can apply Thuja mother tincture, but that is not necessary in other cases. So we have to discriminate between the true surgical diseases and the false surgical diseases. The false surgical diseases, as I told, they are the what? They are the callosity, they are the keloids. That should be corrected, that should be cured by internal medicine. This knowledge we are getting from organon medicine, and that should be applied when we treat any case. And then for future reference, the case recording performer is needed, and during case taking, the knowledge of verbal and knowledge of non-verbal collection. Non-verbal collection means in case of child, not in case of imbecility, in case where the person is not expressed due to mental disturbances. I am giving an example of L.M. Khan. L.M. Khan once he had come to my college, and he told that a patient came to him, and the patient, when he was sitting, what he was doing, he was putting the ring in one hand, then other hand like this, changing. So on that basis, without taking more time, he select pulsatile because of changeability. So this type of observation that observation is the knowledge is gained from organon of medicine that should be applied. Again, I have written here there are two type of filter. One is passive mechanical filter, another is active filter. Mechanical filter those physicians which are new physicians having less experience, they consider all the symptoms, all the quantitative and qualitative symptoms, takes more time and select, and they take more time to select a medicine. But if the physician is experienced physician, I use the active filter and select the medicine very easily. For example, a patient comes to us or in our clinic, and if the patient after coming first he or she clean the chair, then if he saw that there is some uneven photograph, he make it even and very neat and clean. So without going details, we can think about arsenic, that is fastidious specific. So this knowledge of observation, that knowledge we are getting from the organon of medicine, and that only can occur because of freedom of prejudice, sound senses, attention in observing, fidelity in tracing the picture. So being a homeopathic physician, we should not be prejudiced by our seniors. We should not be prejudiced by our own experience. You should be free from prejudice, and every case must be taken as a new one, and accordingly we have to treat the case. If you will not do like this, you will be prejudiced. Then you may, if you consider our medicine, that is what we call the medicine in which we have cured so many cases. For example, conjunctivitis. In so many cases, you have cured the conjunctivitis by belladonna. So without going thoroughly, if you treat by belladonna, then you will be failed because there are so many medicine for conjunctivitis. So in those cases, we have to take as a new case, and we have to select the medicine as per the symptoms and signs concerned. Then only will be success. Then as I have already told, first we have to fulfill the three conditions after getting the knowledge. The 3 points: C minimum, which should be selected by out of all similars. Then our role is to select the proper dose and potency, that is minimum dose. Our principle monominisimi, we have to select minimum dose, and potency should be selected on the basis of susceptibility, and susceptibility should be judged keenly, because susceptibility, without the knowledge of susceptibility, it is very difficult to cure the case. As we know, susceptibility is directly proportional to the reaction power. So if the person is more susceptible, the potency is high. If the person is less susceptible, the potency is low. Even here there is contradiction. Hahnemann has already written that the potency selection, we know that higher the potency, higher the susceptibility. But when the patient is in growing age, for example, a girl of 12 years and a girl of 9 years. So 12 years girl, that is puberty. So puberty age. So in that age, what happens? There is new hormone is secreted, and secondary sexual character is comes. So in that case, the 12 years girl it will be more susceptible than 9 years girl. So here the potency of 9 years girl and the potency of 12 years girl will differ. So that knowledge we should have. So this time, in case of pregnancy, the lady is more susceptible. So in that case, we have to consider that age is not only the factor, and this knowledge we are getting from organon of medicine. Though the susceptibility is universally proportional to age. For example, when the age is increasing, then the susceptibility decreases. It is universal rule. Age increase, susceptibility decrease. But in menopausal period, menopausal time, the lady become more susceptible. So when the lady become more susceptible, accordingly you have to select the medicine as per a repetition is concerned. So Hahnemann has introduced repetition in 6th edition of ORGANON, which was published in 1921. So what about repetition? In repetition always depends upon the nature of the disease, nature of the patient, nature of the medicine. So this knowledge we are getting from ORGANON, and that should be implemented whenever we are treating the case. For example, Lucas aspera, that is a medicine for snake bite, written in Boric Mathematica. Suppose a case of snake bite to come to you, and will prescribe Lucas aspera mother tincture. Then we have to repeat the medicine frequently. So here the nature of the disease require frequent repetition. Second thing, a person who is suffering from diarrhea and he has passes so many times, loose motion is there. So at that time, frequent repetition is essential. And when the patient gets the result, then you may increase the duration of the dose, and you may accordingly you have to deal the case. So in chronic diseases, infrequent repetition is required. As it has been mentioned in lycopodium, lycopodium should not be repeated frequently because lycopodium takes 9 days for its action. So if lycopodium requires 9 days for its action, it will be hurry to give the medicine, then we ourselves will disturb the case. So whenever we are give deep acting medicines like sulfur, like calcarea, like lycopodium, we have to think about the repetition in chronic cases especially. So repetition, the knowledge of repetition we get from organon medicine, that should be applied at the time of treatment. It depends upon the nature of the disease. It depends upon the nature of the medicine. It depends upon the nature of the patient. Then again, acute disease, as you know, individual sporadic epidemic, there are different types of acute disease. So individual case, individual susceptibility plays the role. Individual type of exciting cause is there. So if 5 person they are coming from a place and place by bike and exposure to sun it, and one of them is suffering from fever, then we have to consider that person because of highly susceptibility, that person suffers from sunstroke. So we have to consider sunstroke as the exciting cause, and as per the exciting cause, you may select natriumur, whatever it may be, medicine as per the totality, and we manage the case. Other person they are not susceptible. That's why they are not suffering. So this type of individual type of exciting cause, individual type of acute diseases, they are caused by individual variety of exciting cause where latent sora plays the role. So after curing, we have to give antisoric medicine to prevent recurrence. So this knowledge our organ gives us. Accordingly, we have to treat it. Even in epidemic disease, in pandemic diseases, Hahnemann has clearly advised 103 aphorisms that you select the genus epidemicus, not taking the case of one case, but by several cases. One case will complete a few symptoms, another case will complete other symptoms. Likewise, the medicine should be selected, but an experienced physician can select medicine after examination of 3 to 4 patients, a genus epidemicus, that is the homeopathic specific medicine. But if a newcomer, he should not be biased. He should select the medicine after taking so many cases. So this knowledge we are getting, and that genus epidemicus which is selected, that should be used as a prophylactic, as a preventive medicine for any type of epidemic, even before prevailing. Suppose we know that the epidemic disease is going to be prevail. Which epidemic is measles? Then you can distribute gelsimimum or morbillinum in that particular area, in a particular area before prevailing. So that prophylactic medicine can be administered. Acute exacerbation of chronic disease, that knowledge you are getting from organon medicine. For example, you are taking a case asthma by sorinum. All you know, sorinum patient is chilly patient, and the patient gets relaxed by lying down. But here the knowledge of allied science is also required. If the patient's asthma is ameliorated by lying down, then that may be a case of anemia. So we have to first work out whether the case is of anemia. If it is not anemia, then you have to think about sorinum. And sorinum asthma is ameliorated by lying down, chilly patient, and the patient always feel hungry in the midst of the night. So in that case, if the patient is under your treatment and get exposure to cold drought, cold wind, then at that time, like grandilia or other medicine can be given. That is called acute exacerbation. In that case, acute medicine should be given, and when the patient acute condition will be overcome, then you have to come to the chronic medicine. Again, during the treatment of acute disease, the treatment of chronic disease, acute disease may appear. For example, you are treating a case of eczema, and when you are treating a case of eczema and prescribe a medicine with the discharge, English discharge, and ladies case is during menopause, and there is a history of delayed menstruation, habitual constipation. In those cases, we have to select the medicine that is graphitis, and that graphitis we are prescribing, and in between what happens, the patient went to his friend's house or any party and used to take some spicy food or used to take some oily food. So at that time, that is called acute disease appear during chronic treatment. So when the patient is suffering from loose motion after eating oily fatty food, then first you have to give pulsatilla, and when the acute diseases appear during chronic treatment is cured, then you have to go for your chronic disease, chronic medicine. So one time, one medicine should be prescribed. When you are prescribing acute medicine, you should not prescribe any type of chronic remedy. And when the chronic acute disease is cured, then you have to go for chronic treatment. Then non-miasmatic chronic diseases. So non-miasmatic chronic disease, artificial chronic disease, pseudo chronic disease, you have no scope there. So in case of artificial chronic disease, due to prolonged use of strong heroic allopathic medicine, if the patient comes to you, so if you have the knowledge of organon, what organon told that we have a limitation. So artificial chronic disease means the origin is not natural. So where the origin is not natural, we should not treat it, because that if the case is curable, if the case is manageable, that means if the vital force is strong enough. In 74 aphorism, Dr. Hahnemann clearly mentioned that artificial chronic disease is most deplorable, it is incurable. So there is no homeopathic medicine for that type of cases. So if a case of artificial chronic disease, for example, after taking sedative for a longer time, now the sedative is not working and the person is suffering from insomnia. In those cases, we should consider it as an artificial chronic disease. And in that case, what we need to do, we have to judge the vital force first. If the vitality or the vital force, how we can judge? Because by means of susceptibility, by means of reaction. If the vitality is strong enough, then what you need to do, we have to give placebo to please the patient, stop the medicine, then automatically when the medicine is stopped, the duration of action of the medicine over, then the vital force will remediate it. If any miasm is lurking behind it, like Sora, then you can give antisoric medicine. In 74 aphorism, Dr. Hahnemann has written. So every physician, I would like to request that thorough knowledge of organon is needed, and that organon knowledge should be applied whenever you are treating the case. So non-miasmatic case, artificial chronic diseases case are managed by this, and pseudo chronic disease means false chronic disease. Pseudo chronic disease are caused by maintaining cause. So because that caused by avoidable noxious agent, 77 aphorism. So 77 aphorism, Dr. Hahnemann has mentioned that pseudo chronic disease is caused by avoidable noxious agent. A person, a simple example I am giving, if a person is suffering from dysphagia because of loss of fish bone inside the throat, then there is no medicine for that. So only you have to take the help of mechanical aid, and you have to remove the fish bone, then automatically the dysphagia will be cured. So in case of pseudochronic disease, how to manage the pseudochronic disease, or how to manage the artificial chronic disease, it has been written in 74 and 77 aphorism. So aphorism wise, every physician should have the knowledge, and that should be applied in the field of treatment to get a radical cure. Then miasmatic chronic disease may be single, may be complex. So miasmatic chronic disease, if you have no knowledge of miasm, because miasm is the root cause. Miasm, because of the miasm, what happens? The disease is caused. So which miasm remains behind? The physician should have the knowledge. So if the physician has thorough knowledge about miasm, then he can correlate the constitution with the miasm, he can correlate temperament with miasm, he can correlate diastasis with miasm and treat the case. I am giving example of Gravegel's constitution. So Gravegel has divided constitution into three: hydrogenate, carbon nitrogenate, and oxygenate. If the person is belong to carbon nitrogen constitution, that person will be more liable to suffer from soric manifestation. And if the person is soric manifestation, you have to give antisoric medicine. And carbon nitrogenate constitution, the temperament is nervous temperament, irritable temperament. So this correlation, every physician should have the knowledge, and that knowledge is gained by the organon of medicine, and we can treat even we can correlate the miasm with our genetic point of view. For example, SORA, all the organs which are developed from ectodermal organ like skin, they are more liable to suffer from soric disorders. And endoderm psychotic, mesoderm syphilis. So this type of correlation we can do by taking the knowledge of organon, and it can be implement. For example, superficial organs, those organs are developed from ectoderm, then automatically the miasm can be understood, and according to the totality of the symptom, anti-miasmatic medicine can be prescribed. So miasmatic knowledge also required. We know that Hahnemann has introduced 3 miasm after 12 years of research. So first he introduced in 5th edition of organon chronic disease in 4th edition. So in 4th edition, when he failed to cure certain diseases, then he came to the conclusion that there is some obstacle. That obstacle he named miasm. So if we have no knowledge about miasm, we may treat the case, but we cannot establish radical cure because of the establishment of miasm. Again, Allen has introduced a miasm, that is tubercular miasm. So that knowledge we should have. Tubercular miasm comes in between your psychosis and syphilis. So up to tubercular miasm, the reversible change can be possible. So if the person is in tubercular miasm, then as per the symptom signs is concerned, we have to give anti-tubercular medicine. Then the radical cure can be takes place. So how to find out the miasm? This knowledge we'll get from organon of medicine. So miasmatic knowledge is essential to root out the disease, because if the branches will be cut and the root will be remain, then it is impossible to establish radical cure. So every physician should have thorough knowledge about the miasm and anti-miasmatic treatment, anti-miasmatic medicines. So my screen is not changing. Yes. So my screen is not changing. So I am continuing. Sir, I am audible.
Yes, sir. Yes, sir.
So my screen is not changing now.
Maybe network may be weak. That may be the reason, sir.
That may be.
No, sir. You can directly go ahead.
I'm directly explaining. So after miasm, the thorough knowledge of diathesis, thorough knowledge of temperament, thorough knowledge of the personality of the patient is required. Apart from that, Hahnemann in last aphorism has written that we have to take the help of different type of auxiliary treatment, like your bath, like your magnetism, like your galvanism. So he has already advised that wherever it is necessary, our main objective is to cure the sick. In first aphorism, Dr. Hahnemann has clearly written that the physician's high and only mission is to restore the sick to health, to cure as it is termed. So sick means the individual as a whole. So in holistic point, we have to consider, we should not consider any part, any organ, that knowledge we are getting from organ of medicine. In conventional medicine, what they do, they treat the organ, the target organ. For example, there is inflammation of knee. They treat the inflammation by prescribing anti-inflammatory medicine. But homeopath don't do like this. What he do? So he considered the body as a whole, because all the organs, all the systems, they are interrelated to each other. Without any, without the whole, the organ cannot establish separately. Hand is working when it is with the body. So that's why if the hand is suffering, the hand should not be treatment. If the whole body, it should be considered as a whole. In a holistic point of view, you have to treat. Even Bonnie Hussein, grand generalization has been introduced. So if some symptom is correlated to any part or different parts, then that aggravation, that amelioration can be considered as a whole, and the medicine should be selected accordingly. Second thing, regarding the medicine, organon of medicine, how to prepare medicine, how to administer the medicine, in which way we have to administer the medicine, what medicine we have to administer in which time, that has already been given, the direction has been given. In my PG, Dr. Mohendra Singh has asked me why medicine is administered in empty stomach and why medicine should be administered mixing with water. So at that time, I remember that if it prescribes medicine in empty stomach, then maximum it will come in contact with maximum nerve endings, and it will act in best manner. And if the medicine will be given in mixing with water, then what happens? The medicine will come in contact with nerve endings and it will act better. Even our stalwarts, some stalwarts, they advise that medicine should be given in lower potency, like Richard Hughes, like Donham. So
Yes, sir. Sir, our time is about to finish.
yes,
Just
sir.
7 minutes. Just 7 minutes. So we need a discussion. We can
Yes,
have
sir. Yes, sir.
presentation.
Let us come to the discussion. Actually, my screen is not moving, so I feel happy if there will be some discussion.
Yes, sir. Yes, sir. This is the beauty of homeopathy, because you have shown how one need to use the medicine selection in a different way, and what Hahnemann has told. But as you told that some of the teachers are using the Materia Medica for prescription alone. They are using after studying the Materia Medica. Of course, that can be done, but and the real work is that knowing the philosophy first, and then if you have a very good knowledge in the philosophy, definitely the aid of the Materia Medica, you can directly go on to write prescription. And here, the choosing the right remedy at the right time with the right potency will yield the result in the shortest possible time. This is what we have to do. And I must say that the potency of the medicine is directly proportional to the sensitivity of the patient, that is the individuality of the patient. So that will yield. That's the reason why the children's are it is very high potency medicine, particularly one of term like that, will do much good for children rather than any other person, because they one dose will definitely yield a very good result. I have noted all these things in my clinical practice also. Yes, it is a time for discussion, and those who want to have the question or want to talk with the Professor BIBHU Prasad Panda, sir, you can raise your hand. raise your hand so that we will allow you to talk. Yes, Dr. Ramprasad is waiting for. Yes. Yes, sir.
Hello.
Yes.
Hello.
Good evening,
Yes.
sir.
Hello.
Good evening.
Thank you,
Namaskar.
Dr. Daneji. Congratulations, Dr. BIBHU sir. Very nice presentation. Dynamic lecture. Organon of medicine, applied organon of medicine, daily practice. There are three pillars. In this, there are three pillars. Materia medica is a strong pillar. And the organon of medicine and repertory. Very nice presentation. According to mathematics, there are three diseases, main cause of disease, sora, psychotic, and syphilitic. So very thanks, sir. Very thanks. Thank you, sir.
Thank you very much, sir, for the appreciation. I need your blessing. You are a senior person, sir.
Thank you.
And now I invite Dr. Boglin from Malaysia to interact with Dr. Prabhu. Hello, Dr. Boglin, are you there? Yes. Okay. He's not responding. Maybe Dr. Boglin, are you? Then Dr. Masrina. Please. No, sir, there maybe some network problem. That's why they are not responding. Dr. Boglin, are you there? Yes, he's there. Unable to unmute. Yes. You can say the auto thanks to the session also.
Actually, there may be some network problems, sir.
Okay.
Because that not able, yes, sir.
That's okay. There is heavy rain going on around the world, and that may be the reason.
Yes.
Yes, Masrina, you can say. Yes.
Yeah, I want to express the word of thanks. Thank you so much to our professor here, presenter. I was listening from the beginning. I find that it's a very incredibly informative, and I think we can see your passion for the subject, which is very evident throughout the presentation. And on behalf of IFPH, I thank you for such a high quality content and for your generosity in sharing your expertise with us. Thank you very much.
Thank you, madam. Thank you. Namaste.
Please wait, sir. Tomorrow we will have yes. Tomorrow we will have a session from Dr. Vendra Kumar Verma, Professor and HOD, Department of Organon of Medicine, GD Memorial Homeopathic Medical College, Patna, and the talk will be on PCOD and its homeopathic management. So I think Dr. Rajeshwari has raised hand. No. Is there any hand raised? No. So with that, we come to the end of the day, 1349. It is thank you all for joining this session, and thank you, Panda sir, for your excellent presentation on
Thank you very much, sir, for giving me chance. So let us continue like this.
Definitely, sir. It will continue because of the support you people are giving to the International Forum for Promoting Homeopathy. You can see the videos of the same.
Regularly, you are putting the video. I am also delivering the video in my interns, in the class of interns as well as in fourth year also.
Sir, please ask your friends and students to subscribe the same. There is no money is charged. So
Yes,
that
sir. Yes, sir.
they can watch a day to day homeopathy, what is happening around the world also, the homeopathy.
Yes, sir.
Okay, okay, sir. With that, we come to the end of the day, 1339. It's over to Dr. P. Shaila to moderate the Malayalam session. Thank you all. Good night.
Namaskar, sir.
Namaskar.